But as I look over the names of the 35 men and 3 women who previously received this honor, I'm humbled to now be one of them with the distinct honor of having the Master Fellow designation. I've been very fortunate to be mentored by many of them in the organization, and those interactions clearly help propel my career in sleep medicine. And to those individuals, I am extremely grateful. This award is about enduring service to the CHEST organization, and I'm thrilled with many hours of preparation, talk development, and delivery and meetings culminated in this illustrious honor. None of that time and effort would have been possible without the steadfast support of my husband, Tom, and my 2 children, Paul and Marie, as well as my parents, who instilled in me a strong work ethic and accountability, and also the many colleagues that I've had the fortune to work with over the years. I'd also like to give a shout out to the amazing and capable women in this organization, including Dr. Levine, Dr. Doss, and Dr. Wolf, who are fantastic role models for all of the women who are members of the CHEST organization.
What does it mean to receive this award? Honestly, it's special. It's humbling. Yeah, everything that I've done with CHEST has been fun. So to be rewarded for something that brings me so much pleasure is sometimes feels a little over the top, but it's also humbling in the sense that I look at all of my peers in the leadership and the people I've known through the years that have given so much to the organization that I just feel extremely lucky to be recognized for it, because I firmly believe that my progression as an academic physician, my promotion to associate professor and professor and dean jobs within my institution, my reputation as a researcher, I owe all of that to CHEST.
Well, CHEST has been an integral part of my career for over 39 years now. I started my career at Duke and have been there ever since. I've been focused on clinical management and physiology, and education to me is a natural extension of these activities. Being more specific, ACCP and CHEST has given me wonderful opportunities to explore educational opportunities. I've been presenting for the last over 30 years at the CHEST annual meetings. I've been involved with guideline developments for CHEST for also almost 25, 30 years, and on planning committees for a variety of programs. So it's been a lot of fun, and I owe a tremendous amount to ACCP and CHEST.
I think receiving this award, of course, real honor. But honestly, I think for years I've seen so many people that I look up to, that I inspire to have some element of them and how they do things and what amazing teachers they are. And I think now to be one of these recipients seems surreal, but I am deeply, deeply honored. CHEST is just a phenomenal group of people, and I have found so many colleagues, collaborators, role models through CHEST. And in fact, I think I found some of my dearest friends and true mentors, and that has been really inspirational and has provided me a lot of support throughout my career.
I am incredibly grateful to the American College of Chest Physicians, both for this wonderful recognition and for their many years of support of me as a medical educator. In my experience as a clinical teacher in our field, there are no other organizations, and maybe not even any academic institutions, that place as much value on or provide as much assistance for the professional development of pulmonary and critical care educators. I attended my first chess leadership development course back in 2005, and I vividly remember listening to Nancy Collop, Lisa Moores, and Mark Rosen, among many others, and thinking that these folks had cultivated the sort of career that I was looking to put together. And so many chess faculty have been incredibly generous with their time and talent over the last decade to help me hone my own craft, including Alex Niven, Jack Buckley, and my co-awardee Bill Kelly. But all of the ideas that the great educators at chess have mean nothing without a great team to implement those ideas. And I want to also recognize Rich Hsu, Lisa Alvarez, Rob Rubito, and Chad Jackson, among many others, as the team behind the scenes that help make all of the chess educators put together outstanding educational products.
An educator just might be the most important thing that you can do, because the stuff you teach gets done to so many of our patients. But you can take your outcomes seriously without ever taking yourself too seriously. Chess has been my home for that, and I've always said it's the home for clinician educators everywhere.
I was asked to tell you what it means to me to win this presidential citation. For me, chess has been the place where I started my career, where my career has blossomed and has changed the person and the doctor who I am. So winning this citation from chess means more to me than you guys will ever know. Chess is my home. Chess is where I go 5 times a year, every year to teach. Chess is where I've met most of my colleagues and friends over the years.
First of all, it's a great honor to receive the President's Citation Award from chess, and I want to thank Dr. Levine for nominating me for this. You know, over the last decade or so, chess has collaborated with the Chinese Medical Doctor Association and the Chinese Thoracic Society to develop a subspecialty training. We call it fellowship training in pulmonary and critical care medicine, or PCCM. The goal was to advance the medical training in China up to the world standards and thereby improve patient care. Prior to our effort, the medical training stopped at residency in China. The leader for this joint steering committee were Drs. Darcy Marcinuk from here and Dr. Chen Wang from China. I served as an executive to carry out the tasks. The fellowship has been successfully established. So far, we already have a 4 batch of graduates. The structures for enrollment, curriculum, rotation, scheduling, and evaluation is all up and running.